Hi there, I'm here with Dr. Bilski, and tell me, Dr. Bilski, what's new?
Well, I'll tell you what's new.
Okay.
Probably never heard of it. I'm sure you never heard of it.
Well, I'm not much on dentistry, so that's why you're here.
You go to the dentist?
I've been there, yes I have, every 8 months.
All right, good. Well, the stuff I do, sometimes it hurts. It can hurt. We're talking surgery, or sometimes we're talking about taking a tooth out, putting an implant in, doing a bunch of crowns. Caps may be another term that you've heard before. StellaLife.
StellaLife.
It's a mouth rinse. It's good. It's all natural. It's made of 16 natural ingredients. It's a liquid, a spray, and a gel. We use it before you come in for an appointment. We have you use it the day of the appointment, and then extend out to maybe about 7 days. So you're on for about 7 days.
What does it do?
It reduces inflammation. It kills bacteria that's in your mouth. It helps the healing process.
Okay.
Within your, we call it the oral cavity, your mouth, your teeth, primarily your gums. So traditionally what we would have you do is perhaps use a medication or a medicated rinse called chlorhexidine gluconate. That sounds scary. Or another,
I don't want that. Please don't give me that.
Another name is Paradex.
Okay.
Right, so that sounds a little bit better. StellaLife is an oral rinse that we use instead of an alcohol-filled type like a Scope or a Listerine, which you see on television all the time. So you're not going to see StellaLife on television. Hopefully guys like me and gals that work in the dental industry, the doctors and hygienists, are talking about it. So it's relatively new. Studies out of Indiana University, the dental school, a lot of promise. Some of the famous celebrity type doctors, oral surgeons, Dr. Michael Picos, who I've trained with, awesome gentleman, nice guy, and straight shooter. Like, he is not going to support anything that he feels is not in the best interest for his patient and also for himself, so that he can keep continuing with the stuff. So, and
again, this is something that I would take maybe a couple days before coming in, the day of.
Yeah, let me give you an example. All right.
All right.
Everyone's afraid about having a tooth pulled, right? Let's just say it's a simple tooth extraction, maybe a wisdom tooth. Most people have to have those done. We would have you use the rinse and the gel. It's called a recovery kit. Start that 3 days before your appointment. Then you come in, we remove the tooth, and we take the gel and we paint it on top, all right? Then we send you home and ask you to use the gel, the rinse, and the spray over the next 7 days. Now, what we're trying to do is preemptively, which means before you even have the procedure, help you to mitigate pain, swelling, inflammation. So inflammation is what we're trying to fight. So real simple, you have a headache, you take an aspirin, Advil, Tylenol. Tylenol doesn't take care of the inflammation, it just takes care of the pain. We're talking about StellaLife rinsing that actually diminishes the inflammation, and there's plenty of studies, pictures, things that I've seen with my own eyes. So we call that anecdotal. It's in the research, that means research written. Anecdotal is what I'm telling you that I see without having anything written to show you.
Well, it sounds really promising and something that anybody, myself included, I don't like pain.
Right.
But is it safe? And I mean, just, the whole opioid thing and just,
So that's there's two things here with that we're talking about. You brought up opioids, so I'll hit that first. That's your narcotic drugs, your Percocets, your Vicodins. There's a crisis. Back when I first graduated 34 years ago, it seemed like we were writing a lot of scripts. Me, as a dentist, we'd pull a tooth, it was kind of automatic. Now we're finding out that we can manage this better with Advil and Tylenol. Well, my doctor says I can't take Advil, I can't take aspirin. Oh, okay, what did we have? Well, we could give you a Tylenol laced with narcotics. That's your opioid, all right? So that's another subject. But for today, the StellaLife is very important, so we can preemptively, before you have the procedure, have you start taking this and help you create an environment within your mouth, so that when we actually do the procedure, you're going to have inflammation no matter what I do. But we're going to knock that down so it's very low, and then the healing process without the inflammation and the swelling and the bacterial counts being decreased, because it's a natural product non-alcohol mouth rinse spray or gel.
That sounds like something I'd be interested in. Certainly, if I had to have something done. And
So here's the good news. But I'm not holistic by training at all. I'm traditionally trained. There's a lot of traditional docs out there. So when pharmaceuticals would come and say, hey, there's this rinse, try this, the Paradix, we're using it all the time. Side effect, staining of the teeth. Oh, by the way, Paradix, when you use that after surgery, it destroys what we call fibroblasts. Fibroblasts are the things that are growing and helping you maintain healthy gums, bone, and teeth. Well, why would I give you something to rinse with?
Yeah, that doesn't sound good.
That doesn't make sense.
No.
So we give you something that's natural, which I love. Use that. We're seeing great results. The compliance, which means the patients are actually following our directions and they like it. So based on principle alone, for me to tell patients why you should use this, I use it personally. Now, I haven't had teeth removed. I haven't had gum surgery. I don't need it. But preemptively, I use it to help reduce inflammation because I'm getting closer to 60 years old. And as we get closer to that 60, 65, 70, the amount of cleanings per year should go up.
Wow, yeah.
The extra care that you need at home, this is a perfect product for it.
StellaLife. Well, always learn a lot from you in these videos, and this is something never heard of. And if you want to learn a little more, watch some of the other videos. You can see them all at bilskidental.com.
Thank you.